old dies suddenly. So the first line told me many things here. So died suddenly is like sudden cardiac death, probably. Autopsy, okay, let's see. Narrowed LED with thrombus, okay. Transmural pale area. So this is MI with sort of, a transmural infarction. So what would be seen 3 to 5 days after the event? The person is dead, but if this person would have lived, what would have, okay, 3 to 5 days after the event. Okay. So basically, now you figured the question is on the timeline of the different changes that happen after MI, right? You've learned that, isn't it, from your first aid or your Robbins textbook? So timeline is very important. They keep asking you these simple questions. Okay. So the timeline, so it says 3 to 5 days. So wavy fibers is the very first few hours, then neutrophils come in, and okay, granulation tissue is formed. Okay, collagen is the very end of it. So it's like a sequence here. So 3 to 5 days, what do you think? Can we pick one choice? Normal myocardial architecture is option E. Uh, I mean, I can just delete this option, remove this option. It's the most incorrect option here because it already told us there is a transmural pale area, transmural pale, and person is dead. And I mean, it's infarction, so it cannot be normal myocardial architecture. Okay, so 3 to 5 days. So this is from your page number 309 on first aid. Please review this. Please learn that. Okay. So got it right, good. If you got it wrong, no problem. Please learn this timeline. Read the questions carefully. No worries. Okay. So basically, 3 to 5 days after MI, what's the timeline going to show you? Okay, that 3 days after MI is the neutrophil thing. Okay. So it's the beginning of coagulation necrosis. Okay, so that is another question they love to ask you is the timeline of granulation tissue. Okay, that's another of their favorite questions. Okay, so keep that in mind. Granulation tissue is around 10 days. Okay, so 10ish days, right? Okay, so somebody's asking me a question. Thrombus without the pale area. No, the reason for death is MI. So whenever there is a thrombus which has blocked the artery, okay, and it has led to MI, the muscles are dead. MI, infarction means necrosis. Okay, so necrosis is not ever going to be a normal architecture. Okay, if it would have been just angina and we reversed it, that would be a different question. Angina, reversed it, no changes. Okay, normal myocardial architecture, but the blood vessels, of course, in that case would be showing you the atherosclerosis and the plaques and all of that stuff, right? Okay, so let's look at another question. So this is a 59-year-old, known history of coronary disease, collapses, dies suddenly. This language, this question telling you dies suddenly, sudden death, like this is categorized as sudden cardiac death, like, and they have used this language here very specifically. Autopsy, okay, severe three vessel atherosclerosis, all the major vessels are blocked, in other words. No acute thrombus, minimal fibrosis. So there is no acute thrombus. Okay, it's saying there is severe three vessel atherosclerosis but no thrombus, means all the three vessels have a stable plaque. Okay, that's what the question is telling you. This is very important, and this is a bit tricky. Please, if you don't understand the concept here, it's very tricky. All the three blood vessels are showing you some blockade because of not a thrombus. It says there is severe atherosclerosis, so severe narrowing of all the three arteries. So does that mean thrombosis? No, it doesn't. It's a stable plaque in all the three arteries. That does mean, though, that less blood is flowing through those three arteries to the heart, isn't it? Okay, all the three arteries have been pushing like less blood to the heart for who knows how many years, right? And now this person died suddenly. question says, what is the mechanism of this sudden cardiac death? Okay, so what do you think the answer is? So in this case, sudden cardiac death reason is always, yes, an arrhythmia. Okay, it's fatal arrhythmia. So what does that mean? Arrhythmia, you started learning about this in physiology. So arrhythmia means heart suddenly went out of rhythm and this patient suddenly collapsed. In this case, if I ask you what caused this patient's arrhythmia, answer will be ischemia. I'm not saying infarction, I am saying ischemia. Can ischemia lead to arrhythmia, and arrhythmias can lead to sudden cardiac death? Yes. Okay. So it's not always that you would have a rupture of thrombus and that led to MI and then the patient had arrhythmia and died. No, that is possible. Yes, I'm not saying no, but you should know that there are other things, other diseases which can trigger an arrhythmia and the patient can die. Okay.